It's now time for us to take a look at news stories making headlines around the globe today. We begin here in Nigeria with the latest situation report of the coronavirus pandemic. 10 new cases have been confirmed on Thursday to bring the total tally now to 184. On a brighter note, however, we have also discharged 11 cases, bringing the total number of discharged cases to 20. Lagos State Governor Babajide Sanwo-Olu broke the news that the 11 patients, being 9 men and 2 women, were discharged from the infectious disease hospital in Yaba Mainland Hospital, as their results were negative in 2 rounds of tests. Nigeria has also unfortunately recorded 2 deaths so far from COVID-19. Now, out of the 10 new confirmed cases that we're seeing here, 7 are in Lagos State and 3 are in the Federal Capital Territory. To date, there have been 98 cases in Lagos, 38 cases in the Federal Capital Territory, 14 cases in Osun, and 8 cases in Oyo. Akwa Ibom has 5, while Kaduna, Ogun, and each have 4 cases. Bauchi State now has 3 cases, while Enugu and Ekiti have 2 cases each. Rivers and Benue states have 1 case each. So, unfortunately, but as expected, Doctor, the numbers are rising here. We're seeing 98 cases now in Lagos being the epicenter, but as a whole, we're seeing 184 cases being confirmed across the country. So, yes, the pandemic is spreading more and more. Over to you.
Well, I think while it is good to, commend the health workers at the isolation centers in Lagos for having successfully now been able to assist up to about 19 persons plus 1 in another state to recover. We should say that, the times still call for a lot of vigilance. Yeah. Because as the Minister of Health pointed out, government has been able to contact trace just about 71% of the 6,000 cases that he had announced previously. And they've been able to trace about 4,700 of these persons. But the calculation is that the numbers in the next few days may also likely, go up now that they've been able to raise the level of contact tracing, and they seem to be succeeding in that regard. So all the persons involved, all the stakeholders involved should not rest on their horse, because we're likely to have more cases. Yeah. Now, secondly, we're told in the various briefings yesterday that the equipment and the face masks contributed by Jack Ma of Alibaba Foundation, about 107 boxes that arrived in Lagos about a week ago have now been distributed. And I think it is very good that a proper breakdown was given, and that, in distributing these donations to the 36 states of the Federation plus the FCT, they took note of the prevalence in the various states, with Lagos State, which has 98 cases, getting more of the kits, and followed by the Federal Capital Territory, which has 38 cases, getting the next largest number of face masks, face shields, and protective equipment. And we hope that all the various states that have been given these facilities will put them to the best use, that nobody will hurt them, and that, nobody will abuse them. Then, of course, the second leg of it yesterday is that the federal government announced that a federal government account has been opened specifically for managing COVID-19. And this is an account that has been opened by the Accountant General of the Federation, bringing to total, about 4 federal accounts. The central bank one, the one by UN France, well, that's not federal government controlled. And then, of course, the one by the NNPC. But what Nigerians are asking for is accountability, transparency in the management of these funds. And it's good that the Secretary to the Government of the Federation says proper accounts will be given.
Absolutely, Doctor. And on that note, we'll go on a very quick commercial break on the show. And when we're back, the conversations continue. Stay with us.
Welcome back to the morning show here on Arise News. Well, Leila, we continue with your headlines. We still have another story.
Absolutely, Doctor. Now, the governor of the Central Bank of Nigeria, Mr. Godwin Emefiele, has tested negative for COVID-19. This day, our sister outfit learned that the test results of the central bank governor were returned on Thursday. Now, this comes just as the governor of Lagos State, Babajide Sanwo-Olu, and his wife, Joke Sanwo-Olu, have also tested negative for COVID-19. So, Doctor, we have some more test results coming in here from public officials, and they are negative, which is great news.
Well, I'm not impressed because it looks like in Nigeria we're not following the protocol as advised by the WHO and those who know, and even by the Nigeria's National Center for Disease Control. They've turned, the privileged public officials have turned this testing for, COVID-19 into some kind of circus. In fact, they seem to think that is a joke because we don't have enough test kits.
Yeah.
We don't have, enough face masks. I mean, the face masks and face shields and protective equipment that they have announced, they are things donated by Jack Ma. Do we have enough test kits? We don't. Even in Europe and the United States, the major issue is about access to test kits.
Yeah.
It's about testing. But it's not testing for everybody. Because the protocol is one, if you have been exposed to a high-risk country, then you self-isolate for a period of 14 days. If you have had any contact with somebody who may have tested positive, then you also self-isolate or you quarantine yourself for 14 days and make sure that you don't infect other people. Now, if you now come down with the symptoms, helplines have been provided, and then you go and take the test. We must understand the need to manage scarce resources. It's called Economics 101. But these days, every big man and members of their family, they are all going for the test. They come out, they tell us that they've tested negative. No, we don't need to hear that, except they have the symptoms. Okay, otherwise they are wasting those test kits.
What it is,
they are turning it into testing negative as if it's a badge of honor, as if it's a status symbol. When they have diabetes, they don't tell us. When they have hypertension, they don't announce it. When they test negative or they have cancer, they don't announce it on the pages of newspaper. We must stop this circus. It's
becoming, and that's the right word to use here, it is a circus. And, the global briefing that Arise News had on Sunday, our correspondent, Femi Akinsanya, I heard her ask a question to Professor Akin Abayomi, the Commissioner for Health, whereby she questioned the fact that someone like a David Doe had access to 31 tests for himself and members of his crew alone. And Professor Abayomi's response was that people may also be able to get private tests, right? So coming across a report like this, of course, the natural assumption is that, yes, they did get these tests through the NCDC, right? But I didn't want to give that stance to go off. But, Doctor, you did hit the nail on the head. It is a circus. It's an absolute circus. Nigeria hasn't tested we haven't tested up to over 2,000 people so far, as reported in yesterday's newspapers. We have so many more people that actually need to get tested. People are coming out on social media with stark stories about how they're actually being rejected. Their calls are not being picked up. Yet here you have your public officials that, instead of following the same public health policy and guidelines that are being given all over the world, are deciding that it's become some sort of game between all of them to get tested and see who's negative and who is positive for COVID-19. And it's an absolute joke at this point.
Well,
however, once again, though, it is good news that they have tested negative, because you do not want to wish COVID-19 on anyone. So
yes, precisely. But they should stop wasting the test kits. Go for test only when you have the symptoms. So that we can manage scarce resources very well. Even in the UK, they are having issues with test kits. Matt Hancock had to come out to give specific 5-step guidelines as to how testing will proceed henceforth.
NHS frontline health workers in the UK don't even have access to tests.
Yes. I mean, just about 16% of them have been tested. In fact, less than 16% of them have been tested.
Exactly. It's an absolute
And yet they are exposed, and some of them have symptoms. They are in their self-isolation. And then here in Nigeria, every government official, if every government official goes for tests, there will be no more test kits.
Exactly. And that's the dark reality that we're facing. Joining us now is Arise business analyst Rotus Odiri for the latest headlines of today. Good morning, Rotus. You're very far away from us this morning.
Yes, good morning, Dr. Bati. Good morning, Leila. Yeah, social distancing, that's what we're practicing this morning. In business, you were just talking about testing just a few seconds ago. The business community right now is also talking about whether or not Nigeria can produce ventilators or import them. Elon Musk, the billionaire who founded SpaceX and Tesla, sent out a tweet stating that Tesla was ready to send out ventilators to countries that needed them based on whether or not, based on how important they needed them. They said that they cannot keep the ventilators in a warehouse. Someone from the Federal Ministry of Finance, Budget and Planning responded to his tweet saying that they needed between 100 to 500. Now, of course, the tweet was deleted, and the government later came out and said that, you know, that tweet was to be disregarded, and it was not an authorized tweet that was supposed to send out. But it sparked a conversation as to how ready we are with regards to how many ventilators we need and whether we can produce them or import them. Temi Giwa, who is the CEO of LifeBank, a tech company that delivers blood using bikes and logistics, put out a map. She put it out on Instagram, showing that Nigeria has under 200 ventilators nationwide. 50% of those ventilators are in Lagos. The others are spread around between Enugu, Delta, Ogun, and a couple other states, pretty much in the southern region. So the question now is, can we do that? What is the debate is between producing them or importing them. Innocent Motors, which is an indigenous vehicle assembly company, said that they can actually produce the ventilators here, but they're going to need a 4 billion naira loan in order to do so. So if we look at how much has been, contributed towards the COVID-19 fight, the discussion now becomes how much of those resources can be allocated to producing ventilators, and do we have enough time? Does the private sector have enough time and assistance to produce them here, or do we import? There's also the issue of price. One ventilator costs about $30,000. According to the DPA Act that President Trump initiated against General Motors, they're looking to take one for about $18,000. Pretty much they're expensive. And with the amount of time we have based on our fight against COVID-19, can the private sector ramp this up? I doubt that they can, or it looks like we have to look at importing. But that is pretty much what this tweet from Elon Musk that was responded to from the, now deleted from the Federal Ministry of Finance. That's the conversation that has now started in the business community as to how quickly Nigeria can respond to this with regards to the need for ventilators.
In my view, we're faced with an emergency, and there could be a combination of strategies. I do not see anything wrong in the Nigerian government, for example, responding to the tweet by Elon Musk of Tesla. And it's not only Nigeria alone that responded. Some other countries, including, I think, Ukraine, also sent a tweet, saying that we're interested in these ventilators that are on offer. But of course, the ministry, the Nigerian federal government, decided to delete that tweet. There's nothing to be shameful about in accessing any help that comes, whether it's from China or it's from corporates in Europe or the United States. Because if you look at it, the question to ask is that what is the ventilator capacity of Nigeria? The latest information we have is that Nigeria does not have more than maybe 300 ventilators, oxygen machines, for a population of about 200 million people. In the event of an escalation of the COVID-19 crisis, then it means we'll be in a very serious situation. We won't even be able to get enough ventilators. I know, of course, that senior health officials have been saying that we don't have a shortage of ventilators in response to the offer by Innocent Motors to retrofit its industrial lines to begin to produce ventilators and medical equipment. I'm not too sure that those senior health officials are telling the truth. And in fact, research and development should be part of our coordinated response to this crisis. And if you have Innocent Motors offering to produce, then government officials should sit down with him and assess the capacity of his company, of his factory, to be able to do this. He says that within 90 days, these ventilators will be ready. And, what government just needs to do is to put a quality control process in place and to ensure that he delivers. But, Nigerians are very funny sometimes. This is not about ethnicity. This is not about, an individual trying to, be part of the process of the solution, when in fact we have said anybody that has a solution should come forward. Every offer, every proposal should be assessed on his own merit. And I do not think that Innocent Motors should just be asked not to bother. Because even if he has the capacity not to produce ventilators, the company may probably have the capacity to produce other facilities that may be needed in the event of a crisis with this particular challenge. And don't forget, in the United States, the government of the United States is even calling on local manufacturers to help produce more ventilators, because the United States also faces a very serious situation. And in Nigeria, we must also begin to think ahead so that we don't find ourselves in the kind of situation that the U.S. finds itself, or the crisis that the United Kingdom is trying to grapple with right at this moment.
I mean, Doctor and Roses, like we always say, prevention is better than cure. And I think Doctor hit the nail on the head speaking about research and development. And that's one aspect that we never invest enough into. Now is the time for us to start doing that. If Innocent Motors has come forward and they have said that they do have the capacity to do X, Y, Z, they are definitely of use to us in the time of a pandemic and beyond a pandemic as well. So, yeah, I completely agree. Government should not be pushing them to the side at all. We are in need of so much help right now. And yes, backtracking on that tweet as well and deleting the tweet was also, it was a bit worrying in my opinion. I mean, other countries had come out and put tweets out, but it kind of also suggested that we don't really know how we want to take approaches. And I don't think that's a stance that shed a good light on Nigeria at all. The Federal Ministry of Finance shouldn't have backtracked on that.
Very true. But also, with regard to think tanks and research and development, I should mention, of course, that at Tedo Peter's side, his INAP Foundation has set up a think tank that is supposed to be providing data and so on how to tackle COVID-19. So we definitely need more of think tanks like that with regards to research and development in order to tackle this, to know exactly mass production of ventilators and so on and so forth, masks and testing kits, how that is going to assist us. So that's the direction we need to go in.
Much, Rotus Odiri. Always a delight to have you on the morning show.
And it's time now for a short break. When we are back, the morning show continues. Stay with us. Welcome back to the morning show here on Arise News. We're now joined by our sports analyst, Aaron Akirijola, for the latest headlines in the sports world. Good morning, Aaron. How are you today?
Yeah, good morning, Leila. And also good morning to you, Dr. Abati.
It's so far away.
All right, quite unusual, but social distancing is the thing right now to keep everyone safe. But now to sports. Since we've been speaking about the impact of coronavirus, one particular league being forward with the way they are going about things. We know that the league was actually abruptly just halted, and it has left several leagues, especially European leagues that have been organized. They've actually flouted the fact that they actually always follow things by the book. Right now they're in a limbo because they don't know what to do. They've gotten money from sponsors, and as it stands right now, they cannot conclude the league. But one league is going ahead to say to themselves that they would actually set the ball rolling by being the first league to declare it finished, and that is the Belgian league. At the moment, there are talks right now that Club Brugge, all right, in the Belgian league will be crowned champions. Of course, the General Assembly will be meeting on the 15th of this month to ratify that particular decision. But as it stands right now, Club Brugge will be the one walking away with the coveted title in the Belgian Julipa. As a matter of fact, two Nigerians, Okereke and Emmanuel Dennis, who has made his debut for the Super Eagles, will be benefiting from that as they are part of that team, and not just part of the team, integral part of the team. So as it stands right now, first league to actually do this, that the big question that is begging to be answered is, will all the leagues like in Italy, Spain, especially England, follow suit?
Well, I don't know whether it's too early to congratulate the two Nigerians that are members of the Club Brugge, Dennis and Okereke. And particularly Dennis, who will be taking his second title. But to the substantive issue, the Belgian League, as you said, is the first to shut down and close. But do you think this is because there's only just one match to go, or because by the time they postpone to June 30, it may not really be convenient? And do you think that other leagues should follow the example of the Belgian League to make sure that in the face of coronavirus, they take extraordinary measures to respond to an extraordinary situation that the entire world, in which the entire world has found itself?
Like the FIFA president said, Gianni Infantino, he said that football in general find themselves in a very, very sticky predicament. And that means that they are moving in uncharted territory. They've never had to go through this kind of problem in a very long time. Football has evolved over the years because ever since the World War II, we've not seen massive interruptions to football leagues like this at this level. Now, the point is this: several leagues are looking for a way to probably cushion the effect, and it is easier in the Belgian league because it's just one more match for Club Brugge to be crowned champion, as against in England, where we'll be talking about in a moment, whereby, as a matter of fact, the English Premier League will be meeting today to decide what will happen. But the reality is this: if before the 30th of June, or July, I beg your pardon, things are not concluded, it throws into jeopardy not just this season, but also the coming season. Because as a matter of fact, the IOC, talking about the International Olympic Committee, have gone ahead to insist that the Olympics will be held from July next year, locking down that date. And that will also mean that Euro 2021, which will be hosted in France, have also locked down that date from June to July. And that means that every club who are member associations of UEFA know that whatever happens, they would have to finish by May to prepare for the Euros in June. So as it stands right now, it is a little bit hard, and we don't know how long this coronavirus pandemic will last. But clubs are still insistent, especially in England, they're being defiant because, like we've spoken about time and time again, there are a lot of hanging threads here and there, and they don't want to probably break protocol at the moment. But if worst case scenario, most leagues, especially the one in Italy, might follow suit, because it stands right now, nobody can say when this pandemic will actually abate.
Thank you very much, Rona Kerejola, for those insights on latest developments in sports.